You are listening to Dr. Carlin Vickery from Fifth Avenue Millennium Aesthetic Surgery.
Well, first and foremost, I would want a doctor who is willing to take the time and listen to what it is that I'm asking for. Before I walked in the door, I certainly would have already checked out that doctor and found out what their training is, where they went to medical school, where they did their training, what their credentials were, and where they've spent their career. That is a basic first start. Following that, then the next thing, ideally, is you would reach out and speak to people within your medical community and ask what their experiences are with that physician, and people you trust, not just random people. Further from that, if you have the opportunity to know people who've actually been operated on and you can see some of the results for what it is that person is what you're interested in, and they're willing to share their results, then that certainly is going to give you more information about whether or not this particular physician shares your aesthetic, and that's going to achieve what it is you're looking for. So those are the starting points. And sometimes you can glean some information from the web, from the Internet. I think every single person that comes in to see me has certainly gone on the Internet and viewed whatever is out there about that doctor. The Internet is unfiltered information, and so that you have to take that in mind. It's not an absolute. You have to look at it in the totality of all the other information that you're looking at. Any physician that's associated with a major medical school or a major hospital generally is somebody with good credentials, and they've earned that right to be associated with that institution, and that gives you a measure of confidence that you may not have if they're associated with an unknown institution. So that is really the starting point. I think the next step is when you come into the office, how the office runs and whether you feel as though the office is taking the time and giving you the opportunity both to speak to them and also to examine you in a way that is a conversation in which you get to express what it is that you want, and there's a thoroughness that satisfies you. There are different aesthetics in plastic surgery. There are certain doctors that are going to appeal to one group and certain doctors that are going to appeal to another group. And I think it's important that there's a good fit, just as with so many other things in life, so that you have the confidence that if you're going to go ahead and let this person operate on you, that you are on the same page and that you're both reaching towards the same goal. Okay, now you've checked the credentials, you're happy with that, you have been to the office, you have spoken with the staff, you've spoken to the doctor, and you feel you're on the same page, and you're planning to go ahead with the surgery. Now, at that point, whether the surgery is done in a surgery center or whether the surgery is done in a hospital, you want to be confident that that facility has excellent staff, both anesthesiologists and perioperative care. I think that the combination of nursing staff and anesthesiologists is really going to impact your recovery. And so it's important that all of those people are first rate as well, because it's not simply what happens in the operating room, it's also what happens within that postoperative period and what your follow-up is going to be and who you're going to be able to call if you have a question and how often they're going to see you, and if you have a problem, how it's going to be taken care of. So that's the totality of what goes into surgery, a successful surgery, and achieving a good outcome.
Visit us on the web at fifthavesurgery.com.